The big, beautiful bill. How is it going to affect you? There has been a lot of talk about how the big, beautiful bill is going to affect healthcare. Now, I am not an expert on this bill, but I am somewhat of an expert in healthcare. So let me tell you what I know and how it may affect you or may not affect you. Now, before you go straight to my comment section, hear me out. The new budget bill, also sometimes called the big beautiful bill, like I said, has been getting a lot of attention. Now, no matter where you stand politically, you should still be asking yourself, how is this going to affect hospice? How is this going to affect our end of life care? Because end of life support is not a political issue, it's a human issue. So let's talk about it. This bill proposes major reform to healthcare spending, specifically Medicaid. It's going to give more power to states, more work requirements, and it's cutting billions of spending federally over the next decade. Now, for some that are watching, this is a win. It's cutting waste, it's improving accountability, but for others, they are worried that it's going to give big gaps in providing healthcare to certain populations, specifically low-income populations and rural communities. But what matters most for us, specifically in hospice, is how is it going to affect our patients in hospice? It will and it won't, and I'll get into it a little bit in this video. So how is it not going to affect us? It's not going to affect us negatively because most hospice patients, if you're above 65, are on Medicare. And this bill is not affecting Medicare. A lot of hospice companies get their money, get their funding through Medicare federally. So we do get a lot of federal money on hospice, but via Medicare, so that part won't be affected. But here's my concern as a person who works in healthcare. A lot of my patients also get a lot of help via Medicaid, which is going to be very much affected over the next 10 years or so because of this bill. Who is on Medicaid? Younger patients who are on hospice who do not have Medicare, they may be affected, maybe. Anyone with disabilities, so anyone on hospice but also has a disability, or maybe they're on hospice because of their disability and they're getting a lot of their funding through Medicaid, they may be affected. Children in pediatric hospice, they definitely will likely be affected. And the biggest one that I think I will see is people in long-term care facilities, which is many patients that I work with. These are people who might be at risk if funding is cut too quickly or if states cannot fill up this gap. I think we all can agree people at the end of their life are very vulnerable. It's a very vulnerable population. Healthcare is needed in these situations, and they already have a hard time getting the help they need. So seeing these extra cuts, I truly hope over the next 10 years, I don't see it personally affecting my patients. Now, I think it may, but we'll have to see. And I think we all can agree that we don't want that. We don't want these vulnerable populations to be affected by this. When Medicaid shrinks, that impacts home health workers, nursing homes, sometimes even equipment that people need to have in their home to care for someone. So it's little things like that that we don't really think about because it's not our day-to-day. But as a nurse, knowing that it is my day-to-day and seeing how many people that I work with that need Medicaid, it can feel scary. And I know I have many patients who feel afraid that they might lose some of their benefits that are desperately needed to care for their loved ones. Across America, 10.3 people in Medicare expansion states may lose coverage, in nearly 7.8 million nationally, mostly in rural communities. In real terms, that means fewer hospice workers in the home, fewer home health aides, and families can be overwhelmed. Because families might start feeling the weight of having to do it all themselves, that could drive these people out of their homes and back into the hospital system, which again raises costs. And like I said, hospice is covered via Medicare most of the time, but these little things will trickle throughout our care. I know I work in lower income areas in Los Angeles where many family members are on Medicaid or are being paid by Medicaid to care for their loved one. And I feel like those families may be affected. If they can't stay home with their loved one can't stay home. Then they may have to go to a nursing home. But if that nursing home is not taking Medicaid patients, then they don't have a nursing home to go to. What And where are these people supposed to go? That is my concern as a healthcare worker in America. Now, to be fair, this hasn't happened yet. Maybe it won't happen. Maybe this won't affect them. We won't know until this goes into effect. I hope it doesn't. I hope we don't start seeing these effects. But if we do, you better believe I'm going to be here talking about it.